Well, good evening, everybody. Welcome to this Concerned Veterans for America Policy Forum with special guest Congressman David Schweikert. I hope everyone is doing well right now and everyone and their families are safe. I'm Joshua Stanwitz, Coalitions Director for Arizona Concerned Veterans for America. For those of you who have not heard of Concerned Veterans for America, we're not your typical veteran service organization. We're actually a veteran advocacy organization. So simply put, our mission is to advocate for the freedoms that we as veterans and those before us fought so hard and sacrificed for to defend. We at CVA believe that veterans and military families offer a unique perspective in the freedoms we have at home, along with the policy that shapes this nation. And that's due to us having skin in the game. We've sacrificed liberties and freedoms to serve our nation here at home and abroad in conflict. And due to this, our lawmakers and leaders tend to listen when we stand together and take action. So when people ask what it is that we're doing at CVA, we're building a movement across the United States of people that are willing to be heard and that want to be active and involved. So having said that, before we start this event off tonight, I'd like to acknowledge a lot of the current events that are going on across our country. A lot of our communities are hurting. They're in pain, with many Americans angered by what's going on, and rightfully so. While tonight we're here to discuss issues that are specific to veterans, we here at Concerned Veterans for America believe that every American should be treated equally and should enjoy their individual rights and liberties. Many of us at CVA, including myself, took an oath to support and defend our Constitution. So trust me when I say that everyone that I work with, we work hard every day to fulfill that oath. So again, I'd like to welcome everybody to the CVA Policy Forum. We're glad to be joined tonight with a man who needs little to no introduction, Congressman David Schweikert. A little bit about the Congressman quickly. Congressman David Schweikert has been serving the people of Arizona's 6th Congressional District for more than 10 years, bringing his expertise in finance and taxes to make real policy change like tax reform a reality for us Arizonans here. He's been instrumental in healthcare reform, a leader on tribal policy, a champion of Arizona's small businesses. And in addition to this, he's been a true advocate for Arizona veterans. And we can attest to that here at Concerned Veterans for America. So again, that's what we're going to be diving into this evening. So thank you, Congressman, for joining us. And typically we like to start out just by asking, like, how are you doing? How's your staff and your constituents all doing during this time?
Look, staff has had to sort of learn this world of working partially remotely. Our district office is back open again, which is nice. A lot of casework, where you and I were having this conversation a month ago or 6 weeks ago. A lot of what the office was doing is, how do you help a small business person get that payroll protection loan? How do you help someone find their unemployment check or their stimulus check? And we're still doing a bit of that, but now we're also getting, hey, I have a problem with Social Security. I have a problem with the IRS. We have all the sort of typical congressional service we provide. From a family standpoint, it has been an educational experience. I have a 4-year-old who's at home, and I have a whole new love and appreciation for kindergarten teachers. And being basically an idiot, we also bought a puppy. So now we have a 5-6-month-old red tick coonhound. So the 4-year-old and the coonhound puppy spend every moment tormenting each other, howling and screaming. So the house is chaos.
Oh, I can only imagine. Well, I know that you mentioned your office is back open out here. At CVA, we always kind of preach the great resources that the district offices provide. If veterans have access or questions about accessing various healthcare or their benefits, especially during this period of time, what are some of the resources that your congressional office can provide?
And that's one of the most important reasons we were excited about this phone call. A, we love the organization, but I will stand up and believe we have an absolutely exceptional veteran service staff. We're really good at it. We're good at working through issues. And there is actually another thing I will come back to in just a moment. The ability to reach out to our office and tell your story. I believe our office was one of the offices that was absolutely instrumental in documenting a number of the case files that were being opened up a few years ago in regards to the Phoenix VA. And we had this series of individuals who'd gotten very sick, or even widows or others who had contacted us saying, my spouse passed away while waiting. Something is wrong. And because of the quality of our staff in our office, we built a file, we got that to the proper authorities, and several months later, the story that broke. So can I also give you something that's incredibly optimistic in this very difficult time with COVID, with so many of the other societal issues that are going on around us? Our office, we think, just may have set an all-time record in young people from our community getting accepted to the military academies. So West Point, Air Force, and Navy, we had 17 accept letters from our community. 17 out of one congressional office.
Yeah, that's incredible.
Yeah, if you want to feel optimistic, hopeful, meet these 17 young people who all have said, we're committing our futures to serving this country, serving the military. Every single one of them, just an outstanding young person. It would give you just sort of hope and joy.
Yeah, that's amazing. And you're right, Congressman. Thank you for bringing that up. I actually saw you guys post your photo on your social media accounts. And to be able to know that, that many from one district alone has committed to serving our country and carrying on our legacy is amazing, and it is hopeful. So thank you for sharing that. I know, moving into some of the questions, I know that you were pretty adamant in your support for the VA Mission Act to give veterans more healthcare options and from community providers. Now, we've seen some confusing guidance from the VA that they're limiting or denying referrals within the community healthcare provider during this outbreak. Now, this is definitely particularly impacting veterans in rural areas, reservations as well. Are you concerned that the VA is taking healthcare decision-making away from veterans and creating more barriers, especially since the Mission Act just passed?
Let's be brutally honest. That's always been the concern. And even in some previous iterations of the reforms, we would find that there were those who were being very creative on how the law was written in standing up barriers or putting clinics within a certain distance to capture populations. But particularly right now, where it's a time of breaking down barriers, being much more creative, everything with options and choice and telemedicine, and hopefully some of the telemedicine that uses technology. And it's frustrating when the bureaucracy sometimes is more defensive of itself than ultimately the underlying mission.
Yeah, absolutely. I know that our biggest concern, and then it's actually going to lead into one of our questions, is, as the VA begins to reopen facilities nationwide, we're concerned that there's going to be another backlog with a wait list and wait times for veterans receiving care. Now, is that something that you've discussed locally with the Phoenix VA, and do you think they're prepared to make sure that veterans are going to be receiving their timely and quality care, again, both inside and outside the VA systems?
Yeah, the answer we've gotten, and I need to admit, we haven't gone very high up in the food chain in part of the discussion. It was a seasonality answer, because there's actually veterans who have talked to us saying, I have a delayed procedure. When can I start doing my elective? I need this done. I need that done. And we've been waiting. And do you get a wave that creates that backlog? How about if that backlog happened right now, and some of the options that are supposed to be out there could be used? I think it could be triaged properly. My fear is if that backlog starts to carry into the cooler months of the year when a lot of our visitors are coming to Arizona, we're going to have some real troubles.
Yeah, absolutely. Absolutely. And that's always been our concern too. And I know that the VAs nationwide, they've all been operating, they all operate a little independently. So it's always created a little bit of fiasco. Moving on to one of your favorite subjects and what we love to talk to you about as well, spending and spending in the bailout packages that have been going on. We here at CVA have always used these quotes. So, the former chairman of the Joint Chief of Staff, Mike Mullen, said once that the most significant threat to our national security is our debt. There has been $3.5 trillion in federal spending over the last 2 months in response to the COVID pandemic. And, are you worried about how significant federal spending and this debt will impact our country's ability to respond to future crisis situations as a country and with our military?
Yeah. And look, I was intensely worried before COVID, and then to have this sudden spike. But it's also an uncomfortable conversation for a lot of us to have, because if you actually sort of break down the nation's debt levels over the next 30 years, they're not sustainable. They're massive that are coming. And the discomfort in the conversation is it's mostly demographic. We as a society, as a country, have made promises. We need to keep those promises. And you may hear a 4-year-old singing in the background. So, but those promises of you earned your Social Security, you earned your Medicare, you earned your VA benefits. Fine. How do we as a society, as a government, make sure we have the revenues, the ability to pay for those things? And most of it looks like it was going to be future debt financing. So the single biggest driver of U.S. debt over the next 3 decades is healthcare. And it's because of our demographics of the baby boomers. So what conversation are Republicans, Democrats, those who actually look at the numbers, willing to have, saying, what are the creative things we could do as a society that actually crash the price of healthcare? Because most of the health, and I'm sorry, I don't mean to geek out on you a bit, but this is really important. The ACA, Obamacare, really wasn't about lowering the costs. It was about shifting who paid. The Republican alternative, in many ways, was much more about who paid. How did we come together and say, we're going to use technology, we're going to use telemedicine, we're going to use the sensors, we're going to use the investments we've made in curing chronic diseases, and we're going to design this as a package so we can provide amazing health care to every American, but by also crashing the price. And there's a lot of resistance out there, particularly in the lobbying community, of those things that create sort of cost disruptions. But they're coming. We just need to legalize them. And the simple example is the telemedicine we have access to today because of COVID actually expires on December 31st, because there were so many lobbyists who want to stop or slow down the adoption of you being able to call a medical professional and receive those services, because it disrupts the current healthcare model. We need more of those things, not less.
That's a great point. I know that we've heard, and myself speaking from experience, I think telehealth and telemedicine has been absolutely amazing during this entire time. But back to the bailouts, we know that you opposed, Speaker Pelosi's massive bailout bill, mm-hmm. and you were discussing the impact. What is the actual long-term and short-term consequences of this type of reckless spending?
Well, this is a tough one, because I'm blessed to hold the senior seat on sort of the Republican House side for the Joint Economic Committee, mm-hmm. and we were grinding out data after data after data, and you're in a world where we're doing our best guesses in some ways, because we've never experienced something like this, where the government takes the hottest, most stable, as the Federal Reserve Chairman said, Goldilocks economy, and says, we're going to crash this to slow down the spread of a virus. And we were doing calculations of, if we did nothing, how deep would the recession be? What would the cost of that recession, if it lasted a long time, compared to if you did certain types of stimulus, certain types of attachment to employment, like the PPP loans? really expensive, but if it shortened up the economic disruption, what is its cost savings? And it turns out in some ways, spending the money, and dear God, we hope we got it right, shortening what would have been a potentially very difficult recession may have been economically and budgetary wise and debt wise the right thing to do. But we don't know the history yet. We're going to have to look back at this a year or two from now and say, did it work? But it's a calculated risk.
Yeah, that's fair. So I know like federal spending efforts, they should be focused on helping people who are hurting, especially during this pandemic, and not as an opportunity to clean up state fiscal problems that dated COVID. So like what message do you think a bailout to fiscally irresponsible states sends to the taxpayers in states like Arizona, right, that have taken responsible actions and steps to keep those drivers of debt,
And this is one of the fights we're having, and in some ways it's gotten fairly ugly. Think of this, a state like Arizona had a several $100 million rainy day fund. Mm-hmm. The early projections were they were going to have almost $1 billion in rollover, meaning at the end of the year, they were going to have that much of a surplus because the economy was so healthy. Thank heaven we had those dollars in the bank, those revenues coming in, because the states that didn't have that shock absorber are truly suffering. But this is a good policy moment to think about. If you and I would have stepped back to January or earlier, the number of political activists, more on the left, others who were screaming and yelling, oh, it's not right for you to have that much money in the bank. You need to spend it. We have programs we want you to spend on. Thank heaven the governor and the legislature didn't do that, because if we didn't have that shock absorber, Arizona would be in a really, and we're still in a pretty darn tough position right now. Imagine how bad it would have been if we didn't have those resources in the bank. And then you look at other states that already were sort of upside down in their budget, and they've hit this. Do you punish Arizonans with future debt at future higher taxes to say we're going to give money to these states where most of those resources end up going to states that had not been being fiscally responsible? And one of the most outrageous things that Speaker Pelosi and some of the others tried pulling was using this to bail out a number of the upside down pensions that are out there. And that was just, talk about something that's fiscally brutal. We're going to have to come up with some sort of solution, but to try to just deficit spend it by packing it into COVID response was a pretty outrageous thing to do.
Yeah, it's weird. You brought up like the unfunded pensions, and I always tell people, like, anybody that even remotely follows any of like state economic policies, like, you have certain states that are just their unfunded pension crisis is in the billions. It's crazy to think.
It will take your breath away. I actually a year ago was on the Multi-Employer Pension Commission, and just that segment. Now that's more of a function of something that sits in the Midwest, where employers and unions came together, set up these pension systems. They played games with the numbers for decades, and now there's stunning unfunded liabilities. And what's heartbreaking about that is there's people who worked in a coal mine or were truckers or other things who are seeing a real fragility of their future retirement benefits on the pension side. And the ability to fix it requires some sacrifices of all parties. And what we're finding in Washington right now is no party is willing to sacrifice. They just wish to throw it on to the taxpayers for the rest of the country. That's fair.
Yeah. So our country is headed definitely towards an unprecedented budget deficit. We always at CVA have pushed on Congress reducing federal spending. Do you think Congress should reduce federal spending, including evaluating DoD spending, which we've been proponents of? And then are there specific areas where you think cost savings could actually be achieved across all federal spending?
The answer is yes. But remember, once again, healthcare is still one of our key drivers. But even if you were going to talk about healthcare, our DoD, or so many other agencies, there's almost this resistance to using technology that could have substantial impacts in spending. So let's hop back, just sort of close a loop conceptually. Remember how we were talking about telemedicine? What is telemedicine? Is telemedicine almost what we're doing right now? Is it just calling a medical professional and talking to them? Or could it be the sensor you have on your wrist, or the thing you hold on your chest, or the thing you blow into, that actually is able to do readings off your body? And the algorithm is constantly calculating your body and trying to keep you healthy. And if it sees something wrong, then brings in a human professional. Turns out those technologies actually exist today, and there's tremendous resistance to them, even though those things could crash the price of just staying healthy. You see the debate we have in some of the DoD spending on large weapon systems. How much could be autonomous? You see some of the most recent discussions of could a fighter pilot have an autonomous wingman or wing person, and how dramatically less expensive that platform would be. And you would see how quickly you get lobbied against those things. So, and we see this happening in other places all over the world, where a lot of our competitors in the world are moving to technology and autonomous delivery systems as a way to actually ultimately get a technological edge, but also crash the price of spending. Because of everything from pension liabilities to just the cost of keeping someone safe is much more expensive than it is being able to build an autonomous vehicle or an autonomous boat or an autonomous mini tank. And I know I'm doing a little bit of futurism with you, but it gives you a sense of just how vested the current model is back in Washington, where if Blockbuster Video had better lobbyists, Congress would have slowed down the internet to stop Netflix. Yeah. You have to sort of think about it in those sort of things, because in many other things in our lives, we're very comfortable with the disruptions. One day the video store down the street went out of business, and because we were all streaming Netflix and other things on our home television. Why can't you have that same sort of disruption in so much of government?
Yeah, that's a great point. And I mean, actually, to hone in on what we fought for forever in CVA, that's the example with the VA too, right? Their lack of modernization, their inability or their inefficiency in information sharing or patient information sharing, because they've been operating on systems that are basically like DOS platforms forever, right? So they're a little behind. We're going to go into foreign policy real quick, Congressman, and then we'll go to audience Q&A if that's okay with you. So
super.
Awesome. So you have long been vocal and kind of supported our various stances on the U.S. presence and the withdrawals and stuff in various countries. So my question is this. Has the COVID-19 outbreak changed at all how you view the U.S. presence in countries like Afghanistan, Iraq, and Syria, and the U.S. resources specifically going toward those wars? As in, has the pandemic, is there a better way to allocate those resources, use them, withdraw? Like, what are your thoughts on that?
Yeah, it's actually a really interesting question. I don't think the pandemic has changed my views, but I think it has created an understanding that resources are limited. We really need to step up and think about how do you protect ourselves? If you're going to spend money, is it money that actually has a value to the U.S. economy? Is it money that is protecting true trading partners? Or is it sort of adventurism in other places of the world that don't have those economic values? And also some of and there's a method to my madness in this part of the discussion. If you and I were to step back 20, 30 years ago, there would immediately be saying, well, we need the supply chain on hydrocarbons, oil. No, we don't. We're now functionally energy self-sufficient. That should have changed types of foreign policy and the way you build your military footprint. And I really haven't seen those reactions. Now, understand, I do taxes, I do trade, I do Medicare financing. Those are sort of my specialties. I'm sometimes not particularly great at politics. I'm trying to do the hard stuff, and that often doesn't make you warm and fuzzy, but it's really important because those are what sort of keeps the wheels on. And if you lay out where we are today, the fact that our population, we're as you know, birth rates in the United States have sort of collapsed. And you start to think about my 4-year-old daughter and what her world is like 3 decades from now. We need to be reevaluating all of this, and I think being much more sensible.
That's fair. So we're going to go to the crowd for the audience for some questions. And sticking with foreign policy, we have a few here that I would like to get into. So, we're going on almost 20 years at war, in the global war on terror. I'm a veteran of GWAT, as are most.
And thank you for your service.
Oh, well, no, thank you, Congressman. Most of us at CDA are. So, one of the questions that we have is, and I kind of agree with what was said here, is, when is Congress going to start prioritizing domestic spending over giving countries who typically want to do harm to the United States or America aid packages and et cetera?
Well, it's even beyond the fact of harm or no harm. It's what's the interest. Mm-hmm. At a certain level, you need to have an honest conversation of what's the economic multiplier. Is this someone we're going to build an economic trade relationship with? Is this someone who is part of the relationships that make the United States ultimately stronger? Mm-hmm. And instead, I think we've engaged in a lot of policies that bleed our resources. And you can't really have this sort of honest conversation saying, I need money, we need money to protect the pensions, protect healthcare. Oh, by the same time, we're going to also spend money on these things that have no sort of societal multiplier back.
Yeah, that's fair. And we actually have a question that piggybacks onto this from the audience, and it's pretty blunt, and it's definitely an Arizonan style question. When can we get out of this endless war? When can we be done with it?
I actually have been heartbroken because I actually thought, a couple of years ago, we were heading that direction. In the unwind, and we had a president that had stepped up and said, this is where we want to go. We're going to invest in the upgrades and the technology and those things for our military, but we're going to actually bring our brothers and sisters back home. And you actually see how Washington reacted to that. Who knows? Maybe Eisenhower was correct when he warned us about the, military industrial. It's obviously the footprint has changed a bit. And inch by inch, there's actually been a coalition coming of sort of Republicans and Democrats, those of us who've been willing to vote for these things, also to step up for Congress to reestablish its position in the U.S. Constitution that ultimately says the United States Congress is the ultimate source of being responsible for declaring war. And even that becomes a brutal battle on the floor of the House.
Yeah, we know that we definitely tackled as an organization the War Powers Act and pushed on that, and definitely.
And you guys were wonderful, because in some ways you're one of the few voices that were truly standing up and helping us.
Yeah, it was unique, and it really was within the community a bipartisan effort between two of opposing veterans organizations. So it was a really unique opportunity for us to work with, typically somebody that has stood against us on various laws and reform in regard to getting constitutional powers back into the hands of Congress and getting us out of these endless wars, right? So thank you for playing your part on that. Going into some other questions, so now we're getting hit with some VA questions. One of the questions that I think is great, and it involves us directly in legislation that you've worked on and supported. One of the questions is, I was a supporter of the VA Accountability and Whistleblowers Protection Act. Do you believe these laws are working?
I only have a bit of knowledge on this, so I don't want to get too far over my skis. We've had some complaints. We've understood there's still been a couple incidences of retribution, but we've also had a couple instances where we've seen some bad actors get moved around. So, look, from what I know, it's like every piece of legislation we do. There's probably things we have to go back and fix it. But we're just now starting to get, at least from a congressional office standpoint, the input we get, particularly for those VAs here in Arizona. We're getting a lot fewer complaints coming to us, but we do have one or two still, in motion right now.
Yeah, that's true. Going into this last one, I think we can close up with this because it's kind of a multi-part question, and then we can definitely go into you.
And those always get tricky, don't they?
Man, that's what I'm sitting here reading, Congressman. I'm trying to figure out how to piece this one together. So these two questions kind of all kind of go in together. So currently, what can people do in your community to ensure, as a veteran or as a citizen or as a spouse, that the VA Mission Act and the healthcare options and choice stay available? What can they do locally to get involved? Can they reach out to you guys? Do they need?
But it's actually a brilliant question. It's reach out to us, but we're already a supporter of these things. Mm-hmm. But we also could use some help. And I don't have a particularly delicate way to say this. There's a number of VSOs that do wonderful things. The camaraderie, they're friends, but often there's a fear of anything that's change. And we need to sort of convince our friends out there, particularly a lot of our older veterans who, God bless them, that this is not about taking anything away from them. It's about providing enough optionality so they always have access to the best level of care. And I've had this discussion at a number of everything from VFWs to some of the Legion posts, those things where you get this. It's not that they don't like the idea; they're concerned. And how do all of us say we're trying to make it better by giving you even more options and availability and accessibility and a timeliness. And so that's a story that those who've had positive experiences need to help us go out there and tell that story. And those who have had difficulties, if you've had it, you need to reach out to us in the congressional office and help us understand what we need to be working to fix.
Well, exactly, Congressman, and thank you for that response. I tell people all the time that their offices are there to help. You guys have proven that time and over again with veterans and working with us and other grassroots organizations. So we thank you for that. Before we close it out here, is there anything that you would like to say or get out before we're finished?
If anyone hears this message, if you know of someone that's out there that's hurting or has difficulties, whether it be in regards to the VA our certain benefits, or one of the other 1,000 issues around our lives, call our office. We're really good at this. And often it's those calls or referring someone to us is how we understand what's going on in our community and how we can be most helpful. And we have staff that's solely dedicated to helping veterans, and they're really good at it. So use those resources, call our office.
Absolutely. It's Congressman Schweikert's office is great, and we're going to give some of that information out here shortly. So again, I wanted to thank everyone for attending tonight. I especially would like to thank Congressman Schweikert, your staff, for helping us set this up and giving us some of your time. I know how valuable it is, especially with a little one running around. So thank you. It's definitely an honor and a privilege to have you on tonight. For anyone in Congressman Schweikert's district that may need help or would like to contact him or his office, you can go to schweikert.house.gov. For any veterans that may need assistance, you can reach out to Lydia Macias. That's his veterans caseworker in military.
And she is a working machine.
Oh, she's amazing. Yeah, absolutely. Lydia is amazing. So for those of you that need it, that are listening or joining us on video, her phone number is 480-946-2411. And her email is Leticia, Leticia.macias, Macias, and that's at mail.house.gov. And again, that's Congressman Schweikert's veterans caseworker and military affairs liaison. And they're really awesome in that office. They're incredible. For those of you that would like more information about Concerned Veterans for America and what we're doing nationally as well as locally, you can find us online at Concerned Vets on Twitter, Concerned Veterans for America on Facebook, and then locally here in Arizona at AZ Concerned Veterans for America on Facebook and Twitter. So again, for everyone out there, thank you tonight. Congressman Schweikert, thank you for your time. It's always a pleasure. And keep doing the good work and putting up the good fight, sir. We really appreciate it on our end. Thank you all. Good night.